discuss about coronavirus. What is coronavirus? Is that virus dangerous? Well, here we will discuss about coronavirus.
Okay, I have a lot of questions about coronavirus. The first, what is a coronavirus?
Okay, coronavirus are a large family of viruses which may cause illness in animal or humans. In humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome or MERS and Severe Acute Respiratory Syndrome or SARS. The most recently discovered coronavirus causes coronavirus disease COVID-19.
The second question, what is a COVID-19?
COVID-19 is the infectious disease caused by the most recently discovered coronavirus. This new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019.
Okay, next question. What are the symptoms of COVID-19?
The most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected but don't develop any symptoms and don't feel unwell. Most people, about 80%, recover from the disease without needing special treatment. Around 1 out of every 6 people who get COVID-19 become seriously ill and develop difficult breathing. Older people and those with underlying medical problems like high blood pressure, heart problem or diabetes are more likely to develop serious illness. People with fever, cough, and difficult breathing should seek medical attention.
Okay, next question. How does COVID-19 spread?
Okay, the answer is people can catch COVID-19 from others who have the virus. The disease can spread from person to person. The disease can spread from person to person through small droplets from the nose or mouth, which are spread when a person with COVID-19 cough or exhales. These droplets land on objects and surfaces around the person. Other people then catch COVID-19 by touching this object or surfaces, then touching their eyes, nose, or mouth. People can also catch COVID-19 if they breathe in droplets from a person with COVID-19 who cough out or exhale droplets. This is why it is important to stay more than 1 meter or 3 feet away from a person who is sick.
Okay, fifth question. Who is at risk of developing severe illness?
Okay, while we are still learning about how COVID-19 affects people, older persons, and persons with pre-existing medical conditions, or such as high blood pressure, heart disease, lung disease, cancer, or diabetes, appear to develop serious illness more often than others.
Okay, next question. How long is incubation period for COVID-19?
The incubation period. Okay, the incubation period means the time between catching the virus and beginning to have symptoms of the disease. Most estimates of the incubation period for COVID-19 range from 1 until 14 days, most commonly around 5 days. This estimate will be updated as more data become available.
Got me feeling right.
Okay, next question. How long does the virus survive on surfaces?
It is not certain how long the virus that causes COVID-19 survives on surfaces, but it seems to behave like other coronaviruses. Studies suggest that coronaviruses, including preliminary information on the COVID-19 virus, may persist on surfaces for a few hours or up to several days. This may vary under different conditions. Example, type of surface, temperature, or humidity of the environment. If you think a surface may be infected, clean it with simple disinfectant to kill the virus and protect yourself and others. Clean your hands with an alcohol-based hand rub or wash them with soap and water. Avoid touching your eyes, mouth, and nose.
Okay, next question. Are there any medicine or therapies that can prevent or cure COVID-19?
While some Western, traditional, or home remedies may provide comfort and alleviate symptoms of COVID-19, there is no evidence that current medicine can prevent or cure the disease. WHO does not recommend self-medicine with any medicine, including antibiotics, as a prevention or cure for COVID-19. However, there are several ongoing clinical trials that include both Western and traditional medicine. WHO will continue to provide updated information as soon as clinical findings are available.
Okay, next. Is COVID-19 the same as SARS?
No, the viruses that causes COVID-19 and the one that caused the outbreak of severe acute respiratory syndrome or SARS in 2003 are related to each other genetically, but the diseases they cause are quite different. SARS was more deadly but much less infection than COVID-19. There have been no outbreaks or SARS anywhere in the world since 2003.
Okay, next. What can we do for ourselves to prevent the transmission of the coronavirus?
Okay, regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. Why? Washing your hands with soap and water or using alcohol-based hand rub kill viruses that may be on your hands. Maintain at least 1 meter or 3 feet distance between yourself and anyone who is coughing or sneezing. Why? When someone coughs or sneezes, they spray small liquid droplets from their nose or mouth, which may contain virus. If you are too close, you can breathe in the droplets, including the COVID-19 virus if the person coughing has the disease. Avoid touching eyes, mouth, and nose. Why? Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter your body and can make you sick. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneezing. Then dispose of the used tissue immediately. Why? Droplets spread virus. By following good respiratory hygiene, you protect the people around you from viruses such as cold, flu, and COVID-19. Stay home if you feel unwell. If you have a fever, cough, and difficulty breathing, seek medical attention and call in advance. Follow the direction of your local health authority. Why? National and local authorities will have the most up-to-date information on the situation in your area. Calling in advance will allow your healthcare provider to quickly direct you to the right health facility. This will also protect you and help prevent spread of viruses and other infections. Keep up to date on the latest COVID-19 hotspot, cities or local areas where COVID-19 is spreading, especially if you are an older person or have a diabetes, heart, or lung disease. Why? You have a higher chance of catching COVID-19 in one of these areas.
Okay, that was the last question. Thank you for information.
Okay, it's the last question from Syifa, and this is the end from our discuss about COVID-19. Stay safe and keep healthy. Keep healthy. And don't forget to subscribe our channel Lenggang Kaki and
Widodari Kemlinthi.